The step of placing the dental implants, the first step, obviously, you come in for a consultation. We will take a CT scan, a 3D scan, to evaluate whether your bone and the location of where the implant gonna go. And then we're gonna do a 3D scan, like intraoral scan of your mouth, of your teeth, so that from then we can place where the implant gonna go. Then I will I plan it where the implant gonna go, and we will send it to the lab to make a surgical guide. It take about a week or so, and then we will schedule you back to get the implant placement. We also gonna make sure that we prescribe you some pre-medication for you to take 1 hour before the implant placement appointment. So on the day of, you will take that pre-medication. It's basically an antibiotic. Then we will get you set up by obviously numb you first, make sure that you are comfortable, and then I'm gonna put the surgical guide in, and then we just gonna start, the step of placing the implant. With the surgical guide, the procedure is very simple and fast. Will take literally about 15 to 20 minutes, include the numbing. Then we give you the post-op instruction of how you're gonna care for it at home, and I will see you back in 1 week. From that 1 week, we make sure that you are doing okay. We will do a follow-up phone call to make sure that you are comfortable at home. If you have any question at all, after that 1 week checkup, then we will see you 1 month. And basically to take an x-ray to make sure that the implant is healing okay. And then from then we will see you for the 4-month checkup. This 4-month checkup, basically we will test to make sure that the implant is integrated with the bone. We test that, and then if it's integrated with the bone, then we will scan it for the lab to fabricate a implant crown. It will take about 3 weeks or so for the lab to fabricate the dental implant crown. We'll give you a call for that when the crown comes. And then we just basically sit that. The appointment very short for the sitting of the dental implant crown. It takes maybe about 20 minutes or so. And then that will be a completion of the whole treatment. Then now you're gonna have a crown there, and you function and eating and smile like normal teeth. Bone graft is important to make sure that you, in the case where you don't have enough bone, we need to add additional bone to make sure that your implant is basically surrounding by good bone. So when you come in with the initial exam with the 3D CT scan, I will able to evaluate that. In the case where you have a bad tooth and you would like to have it removed, we can remove the tooth, place the implant the same day. Sometimes when you don't have enough bone around, we also gonna add bone graft in addition to placing the implant the same day to ensure that you have good solid bones around the implant. So there's multiple options. Well, actually there's 3 options to replace missing teeth. The best option is ultimately an implant, dental implant. The second option is doing a multi-unit bridge. So it's basically crowns that connect to each other to replacing that missing tooth or missing teeth. The last option, which is the one that is could be the cheapest option, however, is not very comfortable, which is a partial denture or a complete denture to replace a whole arch. That would be the pro for that option, obviously the cheapest. However, the con for that would be is not very comfortable, and you need to take it in and out, and sometimes it may not look very natural. The bridge is the second good option. However, is required involving the adjacent teeth. So because we need to using those 2 adjacent teeth to connect them with the bridge to replacing that missing tooth for you. So ultimately the best option is dental implant because it's an individual tooth. You can floss. It's acting like a normal tooth, like individual normal tooth. You don't need to involve the 2 adjacent teeth, and you can floss and take care of it individually. With the technology that we use with the surgical guide, it's very fast and simple procedure. Because it's fast and simple procedure, the healing gonna be very good. So from all the cases that we did so far, all the patients, they may complain of having some soreness the first day. after the implant is placed, after the numbness wear off. But after that, the next day, they're back to normal. It also depends if you're doing something like taking the tooth out and placing implant the same day. It probably will take you a couple of days to recover from the tooth extraction. But other than that, it's very smooth and simple, and the recovery probably will take you the most a couple of days. Dental implant, like I said, is like an individual artificial tooth. So it's like your own tooth. You still need to take good care of it, flossing, brushing, very good. Then you will have it last really long. The longevity of an dental implant is like more than 20 years. However, if you don't take good care of it, if you're smoking, if you are not brushing or flossing well, obviously you're going to lose the bone around the dental implant screw, the titanium screw. Then your implant will become loose, or your gum around that will be bleeding. Then you may lose that dental implant sooner. But if you take care of it as your own natural tooth, it will last you very long. Dental implant is an artificial tooth. It have the crown and is have the screw that connect to the dental titanium screw. It's all titanium and metal, so there is no cavity gonna develop. But you may have periodontitis if you don't take care of the implant by flossing and brushing well. Dental implant, a lot of the time, patient will think it's very expensive. But if it's compared with the bridge, the dental implant is not that much more different. Now, if you have more questions about how much it costs, give us a call, and we're happy to give you a free consultation. And then we can see whether you are a good candidate for dental implant or not. And we have our team can also do some good planning financially for you to help you, fix your missing tooth. That is basically different ways to help you achieve that goal. Most insurance do cover the cost of dental implants. We would like to know what your insurance is, and then we can look it up for the benefit of that. Sometimes different company provide different dental plan. Some plan doesn't cover dental implant, but majority of them do. So you can let us know what your dental insurance would be, and we're happy to look it up for you. You can call us at 253-785-7323 or visit us at firstsmilefamilydental.com to schedule a free consultation exam.